Recently, our studio was joined by Western New York Pain Relief and a patient of theirs to discuss all of the great work they do. Here's a look at that story.
Joining me now are Dr. Christian Miliotto from Western New York Pain Relief and Integrative Wellness Center and one of his patients, Sal. Hi, thank you both for coming in.
Good afternoon.
I'm going to start with you, Dr. Miliotto. As always, you're a recurring guest on Daytime Buffalo, but for viewers that may have missed you and your other appearances, just tell us a little bit about what you do.
Yeah, so our office specializes in nerve and joint disorders. We help people that have back pain and neck pain, have undergone surgery, have been on opioid medication or dealt with chronic pain and kind of lost hope. Our office focuses on helping somebody heal from the inside out, from the start of their pain to the end. And today I was honored to bring in a patient, Sal, to kind of talk a little bit about his story. A lot of people ask me how someone can improve when they've gone through surgery and they've been through it all. And I think the best thing to do is to bring somebody in who's experienced it.
Sal, you are the testimony, so give us a little bit about your story.
Okay. I've been injured 24 years now. I've been through a full segment of surgeries, opiate therapy, in which it became a addiction. So I wanted to get away from that addiction. I put myself in the hospital, got away from it. But meanwhile, I've had 7 surgeries. I've had a morphine pump installed, which failed me, and a lot of electronic stimulator. They are all things that were given hope that they would help me to get out of this pain I was in. The pain was so severe. Not only my back, but running down my leg. Couldn't bend over, couldn't even pick something up off of the floor. And when I went in to see the doctor, I told him about what I'd been through. And I didn't think that he'd be able to help me.
Yeah, you didn't have faith in him.
I didn't have faith in the system. Most doctors that I'd gone to either want to do one of two things. They either want to cut you or they want to give you drugs. Neither one worked for me. And the doctor assured me he could help me. Well, I'm here as a testimony today to say that he has.
Okay.
I am doing fantastic.
Can you give us some examples of the accomplishments you've had through your treatment? You told us before you weren't able to pick things up. Kind of talk about your progress and what you've seen yourself be able to do and how you've improved.
Just being able to twist and turn was a trial. I can now do that freely. As you can see, I'm able to do that. I could bend over, pick something off the floor.
You could do the twist.
And I'm able to enjoy my life now where I was not able to.
Yeah.
My life was just an ongoing trial every day of pain and trying to do things to get out of that pain. And I wasn't able to. And the therapy that the doctor put me through was something that I never heard of before. Nobody else was doing that type of therapy. And when he told me about it, I was like, well, maybe this sounds good. And nobody's ever said this to me before, how to go through all of these different segments that he was going to put me through. And lo and behold, he transformed my life. He gave me back my life. I'm sorry, I get a little choked up because I've been through so much, but he gave me back my life,
Yeah,
yes.
24 years you were in pain.
Yes.
Dr. Miliotto, do you want to talk about what you did and how you worked with him to recover and get Sal to where he is now?
Yeah, so Sal had a back issue, like he said, with the multiple surgeries. He had the nerve pain. He had issues standing and walking. So there's a protocol that we created. We use non-surgical decompression. We are certified nationally to do that and the only one in the region. So we are very specialized in working on people whether they've had surgery or not. We then use a program, and you guys saw a couple people set up with their back, their legs, and their feet. This machine works on damaged nerves and muscles, so it helps with numbness, burning, and tingling. It helps with balance issues. It helps with improving muscular function, which Sal is able to move, bend, and twist. Then we have a Class 4 medical laser, which is designed to work on people that have had surgery, have disc issues and inflammation to accelerate the healing process. The fun thing about the therapies, or what I enjoyed about working with Sal, is he was excited to get onto the decompression unit because a lot of people are afraid. it's not painful. Most of the time he was either snoozing or listening to some music,
Yeah.
and the other two therapies are as well. So the patient gets to relax while we do a majority of the work. It doesn't require somebody to go through physical therapy or painful things or pain medication that are masking symptoms or not helping the person get to that level they're looking for.
Sal, what would you say to someone who's struggling and in pain before, and is like you before you went to Western New York Pain Relief?
Oh, I would say to them, first of all, stay away from the opiates. They'll just destroy your life. It's only a temporal, very temporal fix. And before you do any cutting, any kind of surgery, do yourselves a favor and go see the doctor, because this doctor has helped me way beyond what a surgeon could do.
Absolutely. Dr. Miliotto, thank you for coming in. And Sal, thank you for sharing your testimony.
For more information on everything they do for their customers, visit their website or call the number on your screen.